We're going to be talking about the use of sex enhancement drugs. What are sex enhancement drugs? Sex enhancement drugs are medication that are used to increase or stimulate sexual performance during sexual intercourse. And these medications has found wide use among men of both the elderly and the young. Now, the most common types of sex enhancement drugs that we see are your sildenafil, your tadalafil, which are called phosphodiesterase inhibitors. But before we go into the functions of these phosphodiesterase inhibitors, let's talk about erection. How does erection begin? Erection begins with the transmission of signals from your brain to your body, which is also followed by good blood flow to the penile vessels. There is what we call cyclic GNP, which is a second messenger. Now, the function of this cyclic GNP is to relax your penile muscles and allow adequate blood flow into your penis, which will therefore cause erection. Now, there's enzymes that we call phosphodiesterase enzymes. The functions of these phosphodiesterase enzymes are for the hydrolysis of your cyclic GNP. So they break down cyclic GNP. So once phosphodiesterase enzymes have broken down the cyclic GNP in your body, there won't be enough cyclic GNP to cause or stimulate erection. Now back to the phosphodiesterase enzyme inhibitors, which are the sex enhancement drugs that we are talking about. Like I mentioned, example, tadalafil, sildenafil, Viagra, Vega, whatever brand name that you call it. How does these phosphodiesterase enzyme inhibitors function? They function by inhibiting the phosphodiesterase enzymes. Now, these ones we are actually talking about inhibit phosphodiesterase enzyme 5. Now, the inhibition of these phosphodiesterase enzymes allows enough cyclic GNP, which will allow the relaxation of your penile muscles and also increase the blood flow to the penis, which causes erection. Right now, let's dive in. On one of my videos, I talked about drug dependence and drug addictions. Now, how does this the use of these phosphodiesterase enzymes, your sex enhancement drugs, affects you as a person? Now, continuous use of these medications causes drug dependence, in the sense that you are using this medication so often on a regular basis, it's assumed that your body adapts to this artificial increase in flow of blood to the penile vessels that is caused by this drug. So it gets to a point that your body system or your penile muscles can no longer by itself allow blood flow to the penile vessels, because you're already giving it an extra help on daily basis. So this consistent use of these medications makes you dependent on it. That's the reason why someone that uses these drugs will often come back to it, use it and use it and use it, and at the end of the day, you are not curing it. Now, this is what it does. It does not really cause a permanent cure. It is a temporary cure, because the function is just to increase the blood flow to your penile vessels or your penile muscles. So in this sense, it's not causing you a permanent treatment. Now, the reason why these medications are actually made for elderly people who already have low hormone levels, that is low testosterone level, and also with weak vessels. So this can help them to increase the rate at which blood flows to the penile regions. Now, in the last video I made, or when I was talking about drug dependence, I made it to understand that in treating a medical condition, you don't take a temporary cure but a permanent cure. Now, how can you offer a permanent cure to erectile dysfunction? Now, erectile dysfunction has different causes, or have different types. We have the vascular erectile dysfunction, the one that happens due to issues to the vessels that supply blood to the penile vessels. Also, we have neurological erectile dysfunction, which happens as a result whereby nerve signals are not being transmitted enough to the body, or due to a blockage of nerve signals to the penile vessels that are supposed to increase blood flow. Also, we have due to psychological issues that can be caused by stress and other psychological disorders. Now, having an idea of the major cause of your erectile dysfunction helps you in knowing the best way to tackle it. And the last one, which I did not talk about, is hormonal erectile dysfunction, which is caused as a result of deficiency in testosterone levels. So the best way to take care of erectile dysfunction is first to run a diagnosis to know the major cause and treat the underlying factor instead of taking temporary measures. The temporary measures are only important for elderly persons because they can no longer be a permanent treatment. In the treatment of erectile dysfunction, the best way is to know the cause of your erectile dysfunction and tackle it accordingly. But if you must use any sex enhancement drug, make sure that you are not using it on a daily basis to cause drug dependence. Or if you have any issues with your body or in anything, just reach out to your doctor or reach out to your healthcare provider, and they will know the best thing to do and the best way to follow. I remain your favorite Dr. Best, and see you in my next video. God bless you. Love you.